Okay, I want to talk about fascia for a few minutes. Now, I said in the intro that fascia is like it's a whole system of its own in the body, kind of like the circulatory system there and the lymphatic system. It's really like this whole system of the body. It just doesn't get talked about very much, and it really gets overlooked in pain issues. So this is super important. Now, for fascial tension issues, I am usually using manual therapy. I use my hands. That's the best tool that I have, and I trust what I feel with my hands very well at this point. But you don't have that necessarily because you're watching this, so I want to tell you briefly about fascia just so you understand kind of in general what it is, and then give you a couple of tools that you can use to start to help with this. So fascia is connective tissue. It goes around every muscle fiber, every organ. It's throughout the entire body. Right under your skin, there's a layer of fascia. So if you took your skin off, it would not look a lot different, except it would just be a layer of fascia. And that fascia is connected to all of the ones that go next to every bone and under every muscle fiber and to every cell, basically. So this whole system is connected, and it's very, very strong. Some of the fascia is as strong as the tensile strength of steel. If you've ever, butchered an animal or gone hunting or that sort of thing, and you've seen what sometimes people call it silver skin, that's fascia, the connective tissue. And some of it's very tendinous, but that stuff is strong, okay? If you've dealt with it, you know. And fascia is also the little wispy kind of spiderwebby stuff, like if you get, a chicken or a turkey or something, from the grocery store and you're cleaning it, taking it apart, when it's raw, you'll see all that webby kind of stuff. That's all connective tissue as well. And essentially, because it's all connected in the way that it is in the body, if there's a tension in one spot, that tension, that can be translated to a distant place. So just like as an example, you could have tension or restriction in fascia around your liver. And because of that, it's like if I pull on my shirt here and I do this, well, look, it pulls up here too, right? It's kind of like that. So around my liver, there's this tension, but it pulls all the way up. And I've seen, you can have headaches because you have liver tension, or you could have knee pain or foot pain. Just as an example. So when the fascia pulls on an area of bone or nerve or muscle fiber, etc., it can be really painful. I mean, fascial pain is nothing. It's not a joke. Like, it can really hurt. Okay. And especially if you've got somewhat diffuse pain, or it's like I have low back pain and it wraps around the side of my hip and that sort of thing, sometimes that can be a nerve that's getting pinched, and fascia nerves actually regularly get pinched in the fascia if there's a fascial restriction. But it can also just be the fascia, from your spine going around the sides. So I want to just show you a couple of things, or explain to you really a couple of things that you can do at home. The main fascia that I would want you to focus on for your low back is going to be, so I'm showing you my back because I don't have anybody here, but the little dimples in your back, right there, if you feel into that little dimple, there's a bone there, and it's called the PSIS, the posterior superior iliac spine. Name doesn't matter. It's the bone on your pelvis, okay? And if you follow that bone, around over your hip, there's your pelvis bone here, okay? So if you kind of trace that, right above that is one of the main places that I want you to focus, okay? So here's my pelvis, right above that, okay? And from that bone over the top is one of the places that I want you to focus on. And what you can do is one of the simple things you can do is get a tennis ball or a racket ball. Might be a tiny bit more forgiving. There's actually balls that are made for rolling out your fascia. There's fascial rollers, like back rollers, foam rollers you may have seen. Anything like that. You're wanting to roll out on your back, and I want you to really focus on that spot. So you can just lay on it and put pressure right on that spot, you're breathing into that when you're laying on it, okay? You can even imagine that when you're breathing, it's coming in and out of that spot where the pressure is from the ball or the roller, where it hurts. You're breathing in and out of that, and that just is a way that helps your mind to basically kind of relax into that spot. And you should feel it start to melt. You don't want to be fast and vigorous. You want to just go slow and gentle, sometimes stopping in one spot. And you're just going to roll it. This is my pelvis. You're just going to roll back and forth kind of over the top of that, okay? The other area that I want you to focus on is right below that, okay? So we're finding from that dimple, our pelvis, we're going to go above that, okay? That's certain fascia. There's a lot of nerves there that can actually get compressed from the fascia, so work on that all the way around the side, okay? Then you're going to go below that, and actually it doesn't feel like it, but when you go below that, okay, that's actually your glute muscle or your butt muscle. It goes all the way up to the top of that and connects at your pelvis there at the hip. So you're going to go below that, and you're going to start to release the top of the glute muscle where it attaches, okay? So you're just going to basically roll across the top of your pelvis and the bottom of the crest of your pelvis there on both sides. Even if it's only one side that hurts, do both sides. You might as well do that every day. Be gentle with yourself. Don't try to be, this hurts, I can dig in, I can take it. Like, it's not really about that. It doesn't take much to affect the fascia. It honestly, most of the time, it just takes a little bit of intention. It's kind of amazing. Like, you can even use your hands sometimes and just like press in lightly, and just doing that and putting your intention there will help the area relax. So we're just trying to get that all to relax a little bit. And then the other thing is, along the sides of your spine, basically. If you go out from your spine, you go basically one finger width over, that's a pretty good spot to work along the sides of the spine. I wouldn't work right over the top of the spine, but honestly, those are the only areas that I really think you need to focus on in terms of working out your fascia and rolling it out. Cool little trick here that I'll give props to my dad for discovering this many years ago when he had low back pain. So a thing you can do that's really awesome for rolling out your fascia is the 2-liter pop bottles. I'm from the Midwest in the US here. We call it pop. It's, if you don't know what I'm talking about, soda. The 2-liter plastic bottles, and you can get for 99 cents, you can get like a cheap soda or something. Don't drink it, dump it out. Get the tap running with hot water and fill it up. And you fill it up all the way to where the water's even like beating up over the top. And then you put the cap on as tight as you can get it. So it's just pretty rock hard full of hot water. And those things are strong. You can stand on them. Gosh, my dad was over 200 pounds at the time, and he would lay his whole body on those. You can put a ton of body weight on them. They won't break, and you can basically use it as a hot fascial roller. It feels really, really good, and it's even got the little nubs on the bottom that you can use to sort of massage the areas out. So I'm trying to help you get into a routine with this. I'm giving you a lot of information, but I want you to daily, you're basically giving attention and love to yourself and to this particular area of your body. So in your routine, you're doing some of the core activation stuff. You're going to do some fascial rolling at that time. Throughout your day, you're going to bring your attention to how am I sitting, standing. I'm being really mindful about how I'm bending over. Am I activating my core? These things, this is a lot, really. If you haven't been doing any of these things, it's a lot of things to start to incorporate because it's a behavioral change, which are some of the harder things to do. But I promise you, just putting the intention into starting to do these things for yourself, it's going to start to shift the pain. what we don't want to do is constantly try to escape the pain. And I totally understand. I work with chronic pain. I've had chronic pain issues of my own. I understand wanting to get out of pain, but that can't always be the goal, because within that, whether we're playing video games to get away from our pain, whether we're taking opiates to reduce the pain, cannabis to the level that's getting us stoned, it's at some level dissociative. And dissociating from pain in the physical body is no different to our brain than dissociating from emotional pain. It would be like someone close to you dying and dissociating from that and not grieving. So we have to bring this intention and bring this focus into the area. I also understand we have to function in our lives, and so sometimes it's like, I have to take this ibuprofen because I have a job to do. I understand that, and so I'm not discounting that. But what I'm advocating for is for you to start taking intentional time every day where you're giving attention and love to this, and even if there's pain, that you're sitting with it and you're basically saying to your body, I see you, I feel you, and we're going to work through this. Okay? The next video is going to be, what am I talking about? Inflammation. That is a real piece that comes up in some of low back pain issues as well. So we'll talk briefly about inflammation and a couple of things that I do in my practice. All right, see you there.